we will start the webinar now because we are already 2 minutes late now, and I can see the people are still joining. We have over 100 participants today on this webinar, and we are expecting some more because we have over 1,500 registrations for this webinar. So today webinar is focused on the topic for today webinar will be supply chain workforce strengthening for better results, which will be presented by Mr. Billy. He's the Director General, ZAMMSA, and Professor Andy. He's the Director Training and Capacity Building from Empower School of Health. This session will be for one hour, and we will be having at the last we will be having a Q&A session. So I would request all participants, if you have any question, please put it on the chat box, and those will be addressed during the Q&A session. The recordings will be available on Empower School of Health YouTube channel, and also this session is live on Empower Facebook page. At the end, all of the participants will be giving a certificate for the participation, and that will be sent to your registered email ID, which is registered with us. This will be the flow and agenda for today's webinar. So we will be going as per the agenda, which is mentioned over here. I would request my backend team to please keep adding people because I can see people are on waiting room right now, and please admit all of them. So the housekeeping announcement for participants, kindly please mute your mic and turn off your videos. Please ask questions using chat box, raising your hands if you would like to speak. And if we'll be having a time, surely we will be taking your questions. Please participate in the poll. We will be having two polls, the general questions, and we basically would like to know about your brief information. So please participate in the polling. Then, as mentioned, webinar recordings will be available on Empower School of Health YouTube channel and also on the Facebook Live. Slide deck will be shared with all participants. Then there are a few housekeeping announcements for speakers. Please turn on your cameras for better engagement. Please mute your microphone when other speaker is speaking. Please adhere to the webinar time. The webinar objective will be addressed on supply chain workforce strengthening for better results. And we are organizing this webinar in collaboration with ZAMMSA. This is the time for poll 1. I would request my backend team to please launch poll 1, and I would request all participants to please participate in this poll. They are very basic questions. What is your gender? What is your age? What is the geographical region are you from? What is the academic background? How many years of experience do you have? So it won't be taking much of your time. Please participate in this poll. We will be waiting for a few seconds. Thank you.
And just to mention that you can scroll down as well to see the other questions. Welcome, everybody.
I can see 41% of participants, they have participated in the poll. I would request others also to please participate. The percentages keep increasing. It's 47% now. We still have 50% more to participate in the poll. Yeah, it's 60% now. And we will wait for a few more seconds and then we will close it. And we will share the results with all. Now I request my backend team to please stop the poll and we will share the results. Yeah, so the first question, what is your gender? I can see 67% are male and 33% are female. What is your age? 40% are 30, 30 of age, then 38% 30 to 40, and 18% are between 40 to 50, and there are 5% more than 50. The geographical region, more are from Zambia, that is 23%, West Africa, that is 16%, and elsewhere, that is 55%. Okay. The academic background, I can see 32% is from pharmacy bachelor degree, then 16% from pharmacy with an advanced degree, and basic technician was 13%. How many was years of experience? 42% have more than 5 years of experience. Thank you for sharing your feedback
Yes,
on it. And I would
Sonia.
request Professor Paul. Yeah.
Yeah, thank you. Just leave the results. Are you sharing the results? Can everybody see the results?
Yes, Prof.
Yeah, just want to check with the audience. Can you see the results of the poll?
Yeah, they're on the screen.
Yep, good. I can see them as well. I just wanted to confirm. So just to give you a sense, 2/3, 1/3, male, female, that ratio remains pretty constant. But what's interesting is if we look at the younger generation, the less than 30, which we can't do the segmentation here, we'll see a lot more women in the younger generation. The other thing is people like Prof. Andy and myself, greater than 50, actually they're missing greater than 60 and 70 almost, but let's not go there. The dinosaurs are quickly disappearing, but wonderful to see that more than actually almost 80% are between less than 40 years old, which is great. A lot of room for then growth and learning as well, and applying new and fresh ideas. And a request to my team, I see that the elsewhere is 55%. So next time, please do add Asia, Asia and Middle East, and you can add other regions as well, Europe and the United States more and more. They're attending as well. So add other categories. The largest group is pharmacy bachelors. So again, room for growth for masters and PhDs, wonderful. And less than 5 years of experience is about half the group. Okay, so looking forward to listening to fresh ideas as well as our two key speakers continue. With that, I give the floor back to I guess, Sonia, you're going to introduce the other speakers as they start to speak, but it's wonderful to see a large crowd. We have almost 200 people who are in attendance, and having the CEO of ZAMMSA, Billy Mweta, and I had the honor and pleasure of meeting him in person in Lusaka in November last year. It's wonderful to have him here and to listen to his thoughts, his ideas of how he's transforming supply chain. And then, of course, Prof. Andy, who is an academic and an encyclopedia of health supply chain. Thank you so much, Sonia. Back to you.
Thank you, Professor Paul, for your time and for speaking and addressing the participants. Just one question from Rachel ZAMMSA. Rachel, can you confirm if Mr. Billy has joined the session, because I cannot see him. And since he's the first presenter, so. Rachel, can you?
But maybe Rachel can't unmute herself. You may want to.
Sorry, I was actually typing in the chat message. He actually is in Egypt on an official visit, and he had said he would find time to log in. So we're just trying to make sure he's not caught in a place where he's having maybe some challenges with the program that they have right now.
Okay, then I can act as first speaker, and if he can join later, then we put him in. Yeah?
Thank you, Rachel, for your update. So now we'll just move on to next slides. So I will just briefly explain about Empower School of Health. So about Empower School of Health, uh, Empower is a capacity building organization, has worked over 100 countries across multiple languages to strengthen the institutional HR capacity of global health and humanitarian program through digital learning. Our reach has already been reached out to 200,000 public health professionals globally. The focus areas, we majorly focus on three areas: leadership and change management, digital learning, public health procurement, and supply chain. And on the bottom, you can see the 5 domain areas. And on the left-hand side, you can see our clients. This needs to be updated. This slide will basically reflect that till today, how many partnership and collaboration we have established in Africa. And UNITAR and FIP is the recent one. Those are missing over here. It will also be updated. So we are recently partnered with UNITAR and FIP. This is the partner client funders on Empower School of Health, government bodies, UN agencies, donor agencies, academy implementing organizations. This slide will give you an idea about the advisor and faculty member, Professor Paul Lalwani, who's just speaking. He's our director, Empower School of Health, former head of Global Fund, Procurement and Supply Chain Division. Professor Andy is the speaker for today's event. He's the director training and capacity building. This slide will show you the courses that Empower School of Health offers. We recently launched masters in English and French language. And for more information, you can visit our website. We also have a 12-month program that is PGD, Postgraduate Diploma in Global Health Procurement Supply Chain. That is also available in 2 languages, English and French. Then we have short courses also between 1 to 2 months and 6-month diploma course. This is a brief information and announcement of masters that we recently launched with UNITA. The masters, we have 2 categories. One is for 24-month course and another one is for 12-month MSc course. A 12-month MSc is for PGD graduates who have been passed out from and graduated from Empower School of Health. So they are eligible for 12-month master's course, and rest they can apply for 24-month course. As mentioned, we have 12-month PGD also. The fees are mentioned over here, and for more details, you can get connected with us on the email IDs that is mentioned on the website, and that will also be posted on the chat box. In order to also, we have partial scholarship for long courses, long-term courses. Those are masters and PGD. And for more information about it, and for applying for a partial scholarship with the reduced fee, you can get connected with us on the email ID which is mentioned on this slide. That is operations@empowerschoolofhealth.org, info@empowerswitch.org. This slide will be shared with you all, so you have all the information with you. Now, since Mr. Billy hasn't joined, so we will just wait for him to join, and we will be going to Professor Andy. Professor Andy, over to you. Thank you.
Okay, greetings. I'm sure from the people on here, many will have heard my voice already. So just very quickly, I am the Director of Training and Capacity Development at the Empower School of Health. I have over 30 years of experience. It's quite a long time since I was at Ndola or even Livingstone in Zambia, but I do remember those, as well as the Central Medical Store in Lusaka, very well. And greetings to all. I've operated in the field for more than 30 years. So I hope to try and bring some of that experience with you today. And on to the next slide, please. So it's really about supply chain workforce strengthening for better results. And one of the immediate problems we have is that many people working in supply chain have been thrust into supply chain. They may have been working as a pharmacist or a nurse or even a clinician. And suddenly they've been told, now you have to do supply chain work. Well, that's a problem. As a Minister of Health said, when you do that, You lose a nurse or a pharmacist or a clinician, but you don't get a good logistician because you've done nothing to train them. You've done nothing to get them ready for this procurement and supply chain work. And that's an area that we really have to turn round and address. Next slide, please. The harsh reality is we are failing to meet the Sustainable Development Goals, the SDGs for health. And one of the reasons we're failing is because supply chain is failing to deliver the products. Even when we have the medicines, even when we have the health products, we're not getting them through to where they're needed. Yeah, can we mute, please? Yeah, the supply chain is just not performing as well as it should do in the public sector. And that's the harsh reality. It's been estimated we could save 6 million lives over 5 years if the supply chain could perform better. 6 million lives. That's the impact of our healthcare supply chain not performing well. Next slide, please. Well, if we ask, well, why is it not performing well? And the basic problem is we don't have enough people, and with people we have don't have enough skills. We don't have full professionalism. They're not fully trained. Often they've entered on an ad hoc basis and thrust into it. And we have to turn that around and develop those skills and have a supply chain workforce that becomes fully professional with the knowledge, with the skills to perform. Next slide, please. World Bank says it's so bad. This situation on the supply chain and the shortage of staff is so bad. It's not just affecting public health. It's affecting the whole economy of the country, of low-income countries having such problems with their health supply chain. It's a massive impact. The particular shortages are different in different parts of the world. We see that East Africa is different to South Asia, and Sub-Saharan Africa is different again. The Pacific Islands are different again. Different types of staff shortages. The key point is we don't have enough staff, and the staff we have don't have all the skills and knowledge they need. We have to address those skills shortages. Next slide, please. The Global Fund. Many of the countries who are joining us today have a Global Fund grant. The Global Fund says there's a 70% vacancy rate, 70%. We've only got 30% of the staff we need, and the staff we've got are unqualified and don't have enough training. And because of that, we've got poor performance of the supply chain. We're failing to meet those Sustainable Development Goals. We're failing to improve the healthcare of the country at the level we should be doing. Lots of different international players are highlighting the shortfalls of the supply chain. Next slide, please. Well, why don't we have enough people? And why haven't the people got the skills? We've had training programs in procurement and supply chain for 20 years. Why isn't everybody skilled and all ready and going? Well, they weren't that good. They didn't deliver the impact. And many countries don't have the mechanism to be able to deliver a sustainable, ongoing training program in healthcare supply chain. It's not there. There's no mechanism, there's no professional operation, there's no development. And many of the courses have been, frankly, so boring, they put people to sleep. We've had short courses and they've helped, but not much. And the training is not sticky. It makes things better for a little while, but it doesn't overall develop the professionalism that is needed for modern supply chain. Next slide, please. Well, why haven't we got this human resource capacity? Because there's no formal training mechanisms. Schools of pharmacy or nursing or medicine, they don't teach supply chain. I see today we've got many pharmacists who didn't learn about supply chain at pharmacy school. There is one exception, and that's the Hanoi University of Pharmacy in Vietnam, whereby government decree all pharmacy students must qualify in public sector procurement and supply chain management. But for the vast majority of qualifying pharmacists, they're not trained, and neither are the nurses or the clinicians. The management schools, they don't train people in public health. So there are some management schools training supply chain, but it's not supply chain for public health. The finance, the IT, the transport courses, all the other areas that are involved in supply chain, they don't teach public health either. There's nobody actually doing the job. The health supply chain needs logisticians, but it needs logisticians in health, healthcare, public healthcare, procurement and supply chain. And right now, the facilities in most low-income countries are not there to deliver sustainable training in this field. Next slide, please. Well, some people will argue, well, what do you need to train staff for? It's going to be all done by robots. Yeah, very soon they'll take over the warehouse. It'll be automatic operation. And we'll have the zip line, we'll have the drones delivering everything automatically. You won't need any people because the robots will be doing it all. I feel not anytime soon. This really is a complete fallacy, and I want to debunk that today. Next slide, please. This is a prediction from the private sector, the sector that's embraced the technology the most. They automate, they invest in IT, they use the robots the most, and they say, no, technology is not going to solve our problems. We need more people, and we need people trained in healthcare supply chain. It's people that are going to solve the problem, not the technology. The technology can help, but it's not replacing people anytime soon. If we don't focus on developing people, it's never going to work. We're not going to get sustainable solutions. Embrace the technology, use it, but don't expect that to solve the problem. Solving the problem requires people. Next slide, please. I want to give you a little example about the technology and how it needs people to use it. Recently, World Health Organization did a review of various devices for mean kinetic temperature monitoring. There's a couple of devices there on the screen, small little battery-operated portable devices. Well, that's very good. That's new technology. How many of you know about mean kinetic temperature, what it means, and how to apply it? Some of the pharmacists might just remember they had one lecture way back when about mean kinetic temperature in pharmaceutical specifications, but very few people know much about mean kinetic temperature. So how is this technology going to impact what you do? Without people, it isn't. I'll take a moment to explain that. Next slide, please. Most of you will know that health products, and especially medicines, are degraded by high temperatures. And here is a chart that shows how fast they are degraded. So an extra 5 degrees will degrade by a few weeks. But our storage is not at a constant temperature. The warehouse, it might be 35, 38 degrees, even at 11 o'clock and 12 o'clock and 1 o'clock. But by 4 o'clock, it's probably dropped back down again to 27, 28 degrees. How can I make any sense of how my product is degrading, how safe it is, if I've got the temperature going up and down? These graphs are for constant temperatures. That might be fine on laboratory analysis, but it's not what happens in my warehouse system. When I deliver it in the truck, inside the truck going to the clinic, it might be 40 degrees. But perhaps only for 1 or 2 hours. What does that mean? So we have this concept of mean kinetic temperature. Next slide, please. And press again, please. Open all the screen. Yep, okay. So mean kinetic temperature is an attempt to take all of these different temperature levels and bring them into one temperature, which I can compare with and then measure the amount of damage. Point about mean kinetic temperature is it's not a simple average. The higher temperatures cause a lot more damage than the lower temperatures on an exponential graph. It's not linear. So if I go from 25 to 30, 5 degrees rise, that's some damage. Going from 30 to 35, another 5-degree rise is a lot more damage. So it's quite a complex equation. Next slide, please. Yep. Good. And this complex equation is called the Arrhenius equation, and it's there on the screen. And I'm sure you're all familiar with that, aren't you? Huh? And in the past, we've not used it much because it was just too complicated. We couldn't do it. But now, this little box here with a few AA batteries, that does it all for me. Only costs about $20. Wonderful. That's the new technology. But what use is that new technology without people that understand what mean kinetic temperature is and what mean kinetic temperature means? The technology is useless if I don't have people with those skills. Next slide, please. I need to understand them. I need to understand different areas in my warehouse have got different temperatures. And I can map those temperatures now very quickly, very easily with this new technology. And I can identify those products like ampicillin, which are heat damaged very easily, and put them in the coolest part of the warehouse, because not all the warehouse is the same temperature. The technology helps me do that, but it doesn't do it for me. I need people who understand supply chain, who understand about the technology, who understand modern effects to be able to utilize the technology. The technology won't do it for me. And having people trained in those skills and arts and knowledge is what's required to strengthen the supply chain. Next slide, please. Well, okay, that's good. What supply skills do we need? Well, recently, the organization Partners That Delivered have listed out all the skill sets that public health supply chain people need. Find the links on the screen, and they list out everything that you have to know to be able to be professional in doing the job. Quite a large step forward, and they also have detailed job descriptions on the site as well. Next slide, please. So here's an example. They list it out by level, going from associate to leader. So an associate would be a junior worker in the supply chain, and a leader would be a senior manager. And each level is listed out what people need to know, what skill sets they need at each level to be professional healthcare supply chain operatives. Next slide, please. So here's an example. Understand use of medical products. What do I need to know? Awareness that medicines must be identified by generic name. Many of you know that already. That's at associate level, up to senior manager, the leader level. Review the process of analyzing records to show that we're using the generic name. Measure how much we're doing on the generic name. Just one little area, just one little skill set that's needed. And many of you already have that skill set, but there's a great big list of many pages, about 50 pages of all the skill sets that are required. Next slide, please. And we've talked about temperature. What skill sets do you need on temperature? That's listed out there as well. 7.4. What do you need to know? Current technology approaches. That's that little MKT monitor. Know it exists. Okay, up to the leader, analyze the current technology for temperature monitoring and map the warehouse. Do temperature mapping, identify the hot and cold areas in the warehouse. So those are the skill sets that are listed out, and those are the skill sets that are required So when we're talking about strengthening the workforce, this is the skill sets, which is the standard we measure against. Next slide, please. Well, that's great, but how do I get those skill sets? I've been working in supply chain all this time. How do I get that? And you need quality healthcare, procurement and supply chain management training, which fully embraces this new technology. And the problem is, too often, the training courses which are available are not adult learning. They don't follow competency-based learning, and they're not specific for public health. Learning about how to do railway sleepers and tracks is very interesting, but it's not much benefit to you working in public health. You need specific information. Power has developed a competency assessment tool where you can assess what your skill levels are and then see areas where you might need strengthening, areas that you're particularly linked in. Next slide, please. So at Empower, we use a blended learning technique. One of the problems is online learning has got a bad name. During COVID, everybody just took 4 or 5 slides, put it on the internet and said, there, that's online learning. No, it isn't. That's a few slides on the internet. Online learning requires a fully developed course, and we use the ADO technique to develop those courses. There needs to be some face-to-face learning, some web-based learning, certainly. Micro-learning on the mobile phone, virtual labs where you can do what-ifs. What if I increase the size of the warehouse? What if I increase the delivery frequency? What happens? Adaptive assessments, see how well you're progressing, and gamification, playing games to learn. That can help bring some of the concepts and some of the realities home. But it needs quality learning, blended learning, not just a few slides. Next slide, please. Well, okay, Prof, you talk a good story. That's really interesting, but how do we know it actually works, this PSM training that you're talking about, all this blended learning? Many of you will have been involved in addressing COVID responses. And WHO put forward the essential supplies forecasting tool for COVID commodities. It was Excel-based. Some of you may have used it, yeah? And helped to forecast those commodities that you need, like personal protective equipment, like medicines, like syringes and needles, goggles, aprons, all the rest of it. They put it all together in this wonderful tool. Next slide, please. All those people that had done the Empower training course, they could all use that tool straight away. Took it, run with it, bang, we're ordering the materials already. The ones who hadn't, they really struggled hard. They lost time trying to learn how to use the tool, trying to make it work. So we have hard evidence that the training really does work, really brings an impact, especially around these COVID commodities, because that got them off the ground running straight away, being able to order them using the WHO Essential Supplies Forecasting tool. It was a new tool just invented for COVID, but they could use it because they all understood the basic principles and the mechanisms of how it worked. Next slide, please. Asian Development Bank is convinced that supply chain strengthening really works. There's whole heaps of publications about that. In other words, in order to improve healthcare, they understand you have to strengthen the supply chain, and that means strengthening the staff. Next slide, please. How do we strengthen supply chain? With training, of course. Multiple training modalities. That means blended learning. To reach the number of people that need training, of course, it's going to be online learning. There are probably 30,000 people that need training in public health, procurement and supply chain management. You can't reach them on a 1-week course. You have to go to online learning techniques just for the sheer volume of people you need to address. But it needs to be online learning, blended learning, genuine online learning, not just a few slides on the internet. Next slide, please. People are still the key. It is the people that we need. Everyone is talking technology. I can tell you, the robots are not taking over anytime soon. It needs people who can use the technology, understand the technology and how to use it. And the private sector, very strong on that. They are embracing the new technology, but they understand the need for people. We need stronger focus on capacity development, especially in data science, data analytics, supply chain performance monitoring across both public and private sectors. Next slide, please. So if we're ever going to achieve the Sustainable Development Goals for health, supply chain must get better. We must strengthen the overall operation. This COVID pandemic has highlighted all the problems around supply chain and brought it forward. So we have a much better chance now to advocate for strengthening the supply chain, better training, better skills development. There's a great need for staff in healthcare, procurement and supply chain management. Those staff must be skilled and knowledgeable. Okay, that's me concluded. If I'll hand back now to Sonia.
Thank you, Professor Andy, for your presentation. And I can see the few people, they have already pasted their question on the chat box.
Okay.
But before that, I would request, because I can see Mr. Billy hasn't joined yet, Rachel, if you would like to speak and address to the participants for a few minutes, or anyone from ZAMMSA.
Yeah, let's do this first, just before ZAMMSA jumps in. It'll be good to take a few questions related to Prof. Andy's talk, and then we can, ZAMMSA colleagues and leadership can take over from there as well. Okay.
Okay, Prof. So, Professor Andy, I can see there is one question, need for information on MKT.
Okay, I can talk for about 6 hours on MKT. We don't have time for that today. MKT is a way to address how temperature damages health products and especially medicines. So we know it's temperature damage, but people think if it goes above 30, I've got to throw it away. I can't use it. That's not true. The vast majority of medicines and health products can withstand a brief excursion, a short time at a higher temperature. Just how much they can stand, we measure with MKT. Anybody working on the UNICEF vaccines program will know about MKT because it's what they use on refrigerator monitoring. It's a way of measuring the amount of temperature damage that is caused. It's a complex formula, but the new technology makes it easy. I just plug in the batteries, switch on the device, and it will give me the MKT, the mean kinetic temperature. When I have that, I can then equate that to the amount of damage that's occurring to my medicines and health products. Rest of it, more complicated, join one of our webinars on MKT.
Thank you, Professor Andy. There is another question. I think this is also related to MKT, that is kinetic temperature. For clarification, somebody would like you to speak more about it.
Okay, I think we have to pass on MKT because we can talk for hours about MKT and then there's no further benefit there. It's a complex subject. Again, it's about how much damage is done to products.
Can I come in? One of the questions that's been asked is, when are we starting our PhD? You know, and the reason why Prof. Andy's laughing is, when we were about 10 years ago, face-to-face 5-day deep trainings, which included either in a central medical store or in Geneva with other partners, or in one of the countries. We've done them in Addis, in Nairobi, in Mauritius, in Bangkok, etc., all over the world. The request was, could we have a longer one-year program? So we created the postgraduate diploma. with Kent State University, with the International Federation of Pharmacists, and with the UN, UNITAR, United Nations Institute for Training and Research. Then we got a request, could you find us a way to do our masters online while we are working, certified, low cost, reasonable cost, so we don't have to leave our jobs and go off somewhere and get a quality education. So we did that 6 months ago. We are now getting requests for PhDs, but before PhDs, as you would notice, in terms of the experience that most of the attendees have, majority of you have a bachelor's degree. So obviously you'll be going to a master's and then to a PhD. But by the time you finish your master's, within a couple of years, we will have a PhD. And we are speaking to really the right group of partners that will give you that necessary experience in doing the necessary research in global health supply chain and in different verticals and areas. So as Andy usually says, stay tuned and we'll get there. So for the moment, the focus is masters and on live projects and other related stuff. Okay, thank you. Let's jump to, we get everyone's attention with the incredible work that ZAMMSA is doing. And I have to admit, it's one of the most impressive central medical stores that I've attended. And it will eventually become a regional center of excellence. That's the vision of the leadership at ZAMMSA. And it's with that, I give the floor to Billy and or his leadership team to kick off, and then Billy can pick up. Over. Who do we have? I see Rachel. Okay.
Okay. Yes. Greetings to everyone. Thank you, Professor Paul. Thank you, Professor Andy and Sonia. Just want to convey to the team that our Director General will be joining as soon as he can, and we'll start off the presentation for ZAMMSA, and then he'll definitely take over as soon as he's able to join in. He is on official duties, and so there are things that were out of his control that have affected the timing of the webinar. So I think we can begin the presentation and just start with the background of who ZAMMSA is, and then of course Billy will be able to join in and more focus on the strengthening of the workforce and what we want to get out of the workforce development.
So Rachel, before you start, let me introduce you to the crowd over here, okay? We have many youngsters here, and you are part of that group, so they should know that you are someone that they could potentially emulate. So Rachel's been connected with Empower School of Health for many years. She's a graduate with a postgraduate diploma. She was part of our leadership training as well, which she completed last year, and has been one of the rising stars, not only at ZAMMSA, but is recognized for her work in women leadership and leadership in general across many countries with the work that we have done with her. She's spoken at several conferences, and she has that gentle, calm type of leadership, not one of those where she wants to be in the spotlight, but she finds herself in the spotlight, like today, okay? And she steps in, and now she has to be ready to present her and her organization best side. Okay, Rachel, looking forward to hearing your points of view and your thoughts. Over.
Thank you very much, Professor Paul, for that introduction. I am Muyoma. I'm currently working as the operations manager at the Zambia Medicines and Medical Supplies Agency. And I will, as soon as I'm able to see the slide, we'll take you through some of the background so that people can learn more about our institution. And of course, our Director General will definitely take it over from me very shortly. So, of course, our speaker, Mr. Billy Moitwa, will be joining in shortly. We're very privileged to have an award-winning pharmacist and logistician working with us with over 2 decades of hands-on experience in global health supply chain management, as well as experience in working with other organizations in the such as the World Health Organization, and of course the USAID, GHSC, PSM project, and also for the Center for Infectious Disease Research in Zambia. So he will be joining in to finalize the presentation, and I'll just take you through just the background for ZAMMSA. And next slide. All right, so ZAMMSA stands for the Zambia Medicines and Medical Supplies Agency. And what you can see there, I think, is a photo of one of our regional hubs and the staff that we have here at ZAMMSA. And I think you can tell from the photo that we were working even during the COVID-19 pandemic, and a lot of, it did have a lot of effects on our operations. And those are the lessons that we were learning and we're taking on even as we plan for supply chain responses in the future. Next slide. All right, so the Zambia Medicines and Medical Supplies Agency is an institution established by law. Is an institution established by law as a statutory body under the Act number 9 of 2019. And the agency falls under our Ministry of Health and is at the heart of the public health sector supply chain. So we are the institution that supplies all the public health facilities within the country. Next slide. All right, so as enacted by law, we have a mandate, and I think the previous slide, sorry, if you can go back to the previous slide. Yes, so our mandate is procurement, storage and distribution. So that is the procurement of essential medicines, medical supplies, medical equipment, and other laboratory and diagnostic reagents for the public health supply chain, storage, and as well as distribution. So we do store and we distribute to all the public health facilities within the country. In terms of our vision as an institution, we are an institution that is led by a value system, and we really aspire to ensure that everyone in Zambia has equitable access to affordable, quality, essential medicines and medical supplies. And I'm sure this is the aspiration of many countries throughout Africa. And in terms of the mission, we want to be reliable and accountable one-stop health supply chain service for a healthier and productive nation. The values that we espouse are transparency, efficiency, respect, integrity, accountability, teamwork. Teamwork is very important because we can only achieve substantial results by working together, and also to be client-centered, to look at fulfilling the requirements of the health facilities out there. And of course, our primary client and our primary responsibility is the patient that is accessing health services from our many health facilities, and that is who we center all our activities on as an institution. And so we can move to the next slide. Okay, so if you can show the previous slides, sorry. So just to give an outlook of Zambia, I know Professor Andy remembers coming to Ndola and the other places. So that is the Zambian map, and we have 10 provinces, and we have a fixed presence in 8 provinces, and with 7 regional hubs, as well as the ZAMMSA HQ central stores that is within the Lusaka province, which is the capital of the country. So we have hubs in the north, in the east, in the west, and in the south, and these have been strategically placed there to enable us to provide last mile delivery services to the facilities in those regions. Next slide. So in an effort to provide the service of and fulfilling the mandate of storage, we have been embarking on massive infrastructure development over the past years. And part of that is what Professor Paul saw when he was here in Zambia and actually visited our central medical store. We actually moved from having a square area of 7,000 square meters to 22,000 square meters, and the pallet capacity of 8,000 to 32,000 square meters. So this was in an effort to just enhance our capacity to store in a farmer grade environment according to appropriate storage conditions, the medicines and medical supplies that are required. I'm still checking just to see where he is joining in so that he can take on the rest of the presentation. So just watching out for that. Sonia, if you manage to see him on the participants, just you can step in and stop me so that we can hand over.
Sure,
Okay,
Rachel.
so, okay, all right. So in terms of systems, of course, it is very important that we have systems in place that allow us to manage the inventory and the ordering system for the health facilities. As a country, Zambia has the electronic logistics information system that is used by facilities to report and order, and they collect the essential data items such as stock on hand, what they've received, what they've issued, and also losses and adjustments. And these are used to replenish that stock based on the reporting that they do. Next slide. Okay. On the next slide, I wanted to just take you through the other systems that we have in place. We have a warehouse management system called Warehouse Expert that is really a tier 1 system in that it allows us to manage our stock in a more automated manner in terms of barcode reading, using scanners for real-time data capturing, as well as picking stock according to FEFL. And with the introduction of this system, we actually, as a warehouse, did away with the using of papers. The previous system, warehouse management system that we had, we actually were printing pick lists. At the moment, we are using scanners, handheld scanners that members of staff are able to log into, and it actually does real-time data capturing of all their activities. And this warehouse management system also allows us to do performance monitoring, because we're able to track what the staff are doing in real time in terms of how many picks have they completed in an hour, how many loads have they moved, how many putaways have actually been done, and you are able to actually have those performance metrics available. And then, of course, we're looking at GS1. So our system is GS1 ready. So we're just working on the modalities of having our system be able to now just be capturing the GS1 barcodes and being able to track it through our warehouse management system. This is still a work in progress, but it is something that we're looking this is something that we're looking at ensuring that we put in place. And then aside from the WMS, we have a portal that links our central warehouse management system to our hubs. We have 7 regional hubs as shown before. All of them have a warehouse management system, and our portal links them so that there's order transmission between the hubs. So what we do with our distribution system is whatever products are held at the hubs, we map facilities to those hubs. And when a facility makes an order, they just make one central order. And when we review the order, depending on the adequacy of stocks sitting at a hub, the facility may be wholly supplied by the hub, or the order will be split. So the portal looks at stock availability in both the hubs and the central level, and the facility can get either from the central or the hub, and is able to do the splitting based on the stock availability that is present at the time of processing the orders. And the other system that we have in place, of course, is Delivery Expert, and it is an electronic proof of delivery system. So it is linked to our warehouse management system, where our drivers can use scanners and are able to scan the loads that they deliver to a facility, and we can have real-time proof of delivery. This is a system that we're looking at expanding throughout the country. And right now it's not being used 100%, but for a percentage of our deliveries, it's being done, and it's something that we're working on expanding. I also have with me other members from ZAMMSA, even as we are waiting for Billy. I do have our director programs, so he may be able to take up some of the presentation as well, to just talk about the exact capacity building program that we're working on. So Masao So, I believe he has managed to log in.
Rachel, are you referring to Ms. Also Tembo?
Yes, Masao So Tembo, yes.
Yeah, Ms. Also Tembo, if you can just unmute yourself.
Hi, Rachel. I heard you mention my name. Sorry, I missed it.
Yes. Yes. So as we're waiting for Billy, we're tag
Yes.
teaming. So I was thinking that maybe you could take on a few slides from here so that at least the team also gets to hear from our director planning and projects in terms of the capacity building initiative.
Okay, thank you so much.
Can go to the next slide.
All right. So as a country, Zambia, we service over 3,000 health facilities across the country, and our country is divided into 10 provinces or 10 regions, if you'd like. Again, our population, according to the latest statistics, is close to 20 million as we speak. So, to that effect, it has become clear that there is indeed an urgent need to have a deliberate policy in place where we can build the capacity in as far as effective supply chain management is concerned, because now our coverage has really grown like by more than half, looking at where we're coming from. So this is like something that we need to implement like yesterday. Next slide. Thank you very much. There we are showing our distribution operations. We have a hybrid a kind of a distribution system in our country where we have third-party logistics as well as our own fleet as Zambia Medicines and Medical Supplies Agency. As can be seen, where there's a picture of our Land Cruiser there, the terrain in some parts of the country can be quite challenging, particularly during the rain season. So those are some of the areas that we are equally trying to find appropriate means of effectively delivering these health commodities to the remotest parts of the country. Other than maybe by road, we can use, we can airlift some of the commodities until they get to the service delivery points. Again, Rachel, I'm not sure if you talked about the regional hubs that we have.
That you can expand on them. I did talk about how we have 7 regional hubs. So you may expand as you follow through with the presentation, as you go on with the next slides.
Okay, sure. Thank you so much. Okay, there we're just, it's showing a breakdown of the total workforce that we have. As can be seen, we have a total number of 385, 288 staff are based at the main distribution center, which is the headquarters, with 97 of them dotted around the 10 regional hubs that we have. Surprisingly, only 10% of workforce is female. We can do better there. Ladies will not forgive us. Next. Okay. Here, our capacity building strategy is targeting key areas of our operations. The component of quantification, focusing on quantification and supply planning, has just been handed over to ZAMMSA by our mother ministry, which is Minister of Health. All along, this has always been done by Minister of Health. But since we took over the mandate of procurement of drugs and other medical supplies, it was deemed fit that we take up this that we take up this important and crucial activity as well, because the fact that we have procurement in our yard, we could not afford to allow other entities who are away from us to do the focusing and quantification on our behalf. So this, again, by default, it goes to show how much demand has been placed on ZAMMSA as an organization on behalf of the country. Procurement is another mandate that has just been given to ZAMMSA. All along, this has been done by Minister of Health, but not anymore. We are into distribution. Storage and distribution has always been our core mandate until recently, when we were given the additional mandate of procurement of medicines and medical supplies. We deal with inventory management, we deal with the quality systems and performance management. The whole list goes to show how important it is for ZAMMSA to embark on capacity building across its operational areas in order to effectively distribute medicines and medical supplies across the country. And by the way, we reach out to all these facilities using the hybrid distribution system that our area alluded to. That is third-party logistics as well as our own fleet. Next slide. Okay. Here again, before I can run you through this slide, just a little bit more information on our regional hubs. The whole idea is to ensuring that we are running an efficient supply chain management that is end to end. Through our regional hubs, we are able to timely reach out to our service delivery points on a bi-monthly basis. It has been a challenging journey, but I think with the initiative that we have embarked on now to ensuring that there is capacity building in place, this would deliver to the expectations of our clients out there. So in strengthening the workforce, we are hoping to build the competencies, improve efficiencies, install professionalism, promote value culture, facilitate career progression. We have a very strong value system as an institution, focusing mainly on aspects of transparency, accountability, teamwork, efficiency, and many more. When it comes to transparency, we have gone an extra mile where we do not need to interact with our suppliers when it comes to procurement of medicines and medical supplies. Everything is done transparently and in a competitive fashion to ensure value for money. That way, we are promoting, we have pushed up our accountability levels to a level where we have gained trust from our partners, including the government itself, because the fact that we're being transparent, they know that accountability will be there. They know there'll be value for money. So I think this should be the last slide, unless there's Rachel.
No, thank you, Mas also. So even as he pointed out, the capacity building initiative that we want to that we're embarking on is definitely trying to instill competences in our staff. We know that staff are talented. We know they are committed. So we want to at least identify that talent, build on that talent, and then also facilitate for them to progress career-wise in the supply chain. And the capacity building that we are trying to undertake at ZAMMSA is not just to benefit ZAMMSA. As Professor Paul pointed out, we would like to see how the different activities and the different skills that are built will actually be able to be of benefit of not just Zambia, but the region in general. And then we are looking to see how we continue collaborating with partners from different countries that are within the region and outside the region that have gone a step further in some areas, or where they are facing the same challenges that we are, where we can collaborate and see how best we can come up with supply chain solutions that provide a better service for everyone.
Great. Rachel, thank you very much. ZAMMSA colleagues, Masauso, Tembo, thank you very much.
Thank you very much.
I totally understand when the leadership is called in for higher level meetings. I remember when I was trying to meet with Billy and a few other CEOs or director generals of central medical stores that were called in by the heads of state. And this was especially during emergency times and COVID times as well. So no issues at all. You both did a formidable job of conveying the message, and I will let Billy know of that. Thank you so much. Let's, if you could, and I know we're out of time, so everybody else, thank you for your patience. I know we had scheduled an hour. It was optimistic, but what we've noticed is 90 minutes becomes a bit too long, and individuals may not be able to attend the entire time frame. Let me just do this. Rachel and Masauso, just take a look at one response each. Look at the chat if you are able to, and see if there's any question that you would like to answer. A brief question, number one. And also, we will be sharing the contacts of the ZAMMSA team, Masauso and Rachel, so that the individuals can be in contact directly. There's some really interesting questions. Some are very detailed. They would like to know how you do forecasting, or do you have last mile delivery, and how do you do it? How did you introduce change and technology and MIS systems? So all of these are one-day discussions and learnings, which is great. So if you do see a question, let me know. Let me answer one or two of them. Let me just answer one. Andy, if you can pick one up, and then Rachel and Masauso, if you could pick one up as well. You're asking about different training. This was by Anne Nanyonjo, about the trainings and after the Ebola outbreak and COVID-19, etc. Pharmacy school trainings, trainings for junior pharmacists, and scholarships, etc. I know where you're coming from. I'm a pharmacist myself, and I have lived in Africa many years. I know the challenge of trying to find funding as well. So we always look for scholarships. In fact, if you can't afford it, don't hold back in your learning journey. Send in your request, send in your interest. We will, where possible, we will look for full scholarships. And if not, there's always the partial scholarship route, depending on what you're able to afford. But what's interesting, besides the scholarship part, I wanted to emphasize is online learning has the ability to provide flexibility, customization, language adaptation, but it still feels impersonal. And even though, well, with Prof. Andy speaking, I mean, it brings a lot of personality as well. And this is why the partnership with central medical stores, partnership with pharmacy associations, pharmacy councils, the International Federation of Pharmacists, and logistics organizations and associations. We team up with them, so you learn virtually, you apply it on the job, or you apply and you have exposure to an entity like a central medical store. And where possible and where you're interested, we do a lot of live projects with ongoing projects with Global Fund, WHO, World Bank, and others. And you would also get an opportunity to work on some of these projects, which helps you learn, grow, and also strengthens your CV as well. Okay, I'll pause there. Andy, is there anything you'd like to respond to in the notes?
Yes, I think around this training for pharmacists and so on, less than 5% of Global Fund grant applications include anything for PSM. Everybody wants scholarships. No one is putting them in their grant applications.
Very good point.
If you want funding for training, put it in the grant application. Make it there for Global Fund and every other donor organization. No one is asking. You're coming to Empower to ask us for scholarships. You're not asking the donors for scholarships. Get those in.
Right. And just on that note, this is the year where Global Fund is helping co-develop with countries the work plan for the next 3 years. USA is annual. Then there's Gavi. There are many sources of potential funding, and often it works through the ministry and the organization as well. So if you're working for the right organization, you can definitely influence that or request that. And we're also doing the same. We're speaking to Global Fund and others and requesting for scholarships for low-income countries and where people can't afford this. Over. Masauso and then Rachel. Anything you'd like to respond to?
A minute ago, you talked about someone asking about how we implemented the last mile distribution. Did I get that right?
That was one of the questions.
Thank you very much. The background was previously, ZAMMSA used to distribute, rather deliver medicines and medical supplies up to the district level. Then from there, the district would take it up to deliver the commodities to the service delivery point. But then an observation was made that whenever ZAMMSA delivered to the district in such a manner, the next time you go to deliver second consignment, like the following month, following the distribution schedule, in most cases, we would find the consignment delivered the previous month is still marooned at the district. And the response was always that there was a challenge with the transport facilities. Then a study was done to find out exactly what was on the ground. In consultation with the Minister of Health on behalf of government, it was later agreed that a pilot be done to see if it is possible to distribute direct to the health facilities, where these health facilities ought to place their orders direct to ZAMMSA, not through the district anymore. It was piloted for a short period of time. Likely the results were overwhelming, and it was agreed that that would be the best way to go. And the results have shown so far that that's the best way of dealing with last mile distribution. And in addition to that, there's high levels of accountability, both on ZAMMSA side as well as the facility, because you do not need a third party to reach out to them. You're dealing with them directly, so they can easily account for the commodities that you deliver to them. Again, one would ask to say, there was a transport challenge with the district, but how did you do it? Remember, I spoke about strong values that ZAMMSA has put in place. I will single out one, actually two, which is that of transparency and accountability. When you become transparent in your dealings, you attract confidence from cooperating partners. When the idea was sold, it was very easy to win the trust from the cooperating partner side, and indeed, they came on board to support with transport, support with other resources, including systems to ensure that every transaction is captured to the fullest and meet expectations of various stakeholders across the supply chain system. I thank you.
Thank you very much. I believe Billy has sneaked in and managed to jump out.
Yes, he has.
Okay. So Billy, can we, you're almost like this, how should I say, this VVVIP, as we say in some countries, where we're aching to see what you look like and what your words of wisdom. So we give you the floor for the closing remarks. You've timed it perfectly. The participants have stayed on just to hear you. Over. Billy, can you hear us? Can you unmute yourself?
Thank you, Prof. I hope you can hear me.
Yes, loud and clear.
Thank you very much. To start with, apologies that I could not make it in time to participate in this very important exercise, as well as sharing ideas, experiences, as well as learning from others what they are doing. Nevertheless, it's a very point of pride for us as ZAMMSA, implying that we do have a team, and having a team in any activity is crucial for the success. Thanks to part of that team being Manamasa also, as well as Rachel. These are very, very competent supply chain experts in Zambia, and definitely they are available for sharing their expertise with the wider network, as well as learning from the others. As ZAMMSA, we're on a transformation agenda. Key to it is embedding efficiency, also ensuring that we give value for money for everything we do. That is protected by our value system, which we actually are preaching every day. And we are not just preaching, but we are actually working through those value systems. One of the critical things that we've introduced as an agency is the vendor management system we've introduced, Prof and team, where we have now introduced fairness, and not only introduced it, but we have actually institutionalized. ZAMMSA is out of bounds for all suppliers, except when they're responding to our tender or when we are discussing within the confines of the contract that we have. I'd like to thank everybody for having listened to the ZAMMSA presentation. If there are any questions or concerns or contributions, please, let's have them so that my able team can actually respond to that. Thank you, Prof.
Thank you very much. Thank you. Again, first of all, for all the participants, we have more than 250 that have joined over here through Zoom, and many more through Facebook live stream as well, which is wonderful. Let me, with that, Billy, we didn't, 60 seconds, what are you doing in Egypt? Let people know what the exciting life of a roaming pharmacist.
I hope it was an exciting part. This is a very issue of responding to a supply chain issues. We as a country, we are dealing with a very unique situation where we have the resources, but the timelines of the supply chain are not favorable to us because we are starting from a near zero and building upwards. But the clients, which is the Ministry of Health and critically the patients, don't want to see these products like yesterday. So we're looking into within the region, which countries we have a similar product profile, and we have already government to government agreements, and Egypt is one of them. So we are exploring the potential of working with Egypt to see if they can respond to us within a short period to do a bulk procurement and fill our supply chain while we are working on the normal global supply chain, which has its own lead times. Thank you, Prof.
Excellent, excellent. And just so that everybody else knows, one of the areas we are focusing on is local manufacturing, and Egypt is one of the countries that's leading on the African continent in terms of pharmaceutical manufacturing. They are the top 5. Zambia is not there. It will get there. And Egypt is one of those countries. So with that, I'd like to thank everybody. Thank the organizers, marketing team, Prof. Andy, of course, for his guidance and thoughts, and the entire ZAMMSA team led by Billy. Thank you for taking time out from your travel. All the best. Send your questions in. We will respond to them, and so will ZAMMSA. And so don't worry in terms of when we run out of time from here. Okay. Thank you so much. All the best. Actually, before you hang up, can you all put on your video just for a few seconds so we get to see, everybody gets to see everybody. And you can
I
go
don't know what's
into
going on with my video.
Can you go in
It
the
is not
gallery mode, everyone? So you'll see everyone. So if you pick the gallery mode on the view, put your video on, and people will get to see each other, assuming you have bandwidth to do.
It's unfortunate on my end. It
Just
seems
wave
be,
to the rest. Yeah.
I don't know. I seem to be having an issue with my cam. Oh, finally got it.
Okay. There we go. Oh, lovely. Everyone wave so we can take a screenshot. There we go.
Thank you.
Excellent. All the best. Have a wonderful day.
Thank you, everybody. Enjoy
care.
your day.
Thank you, everybody.
Bye-bye.
Thank you.